First of all, thank you very much indeed for joining us. Really appreciate that.
It's my pleasure. Thank you for having me.
So there's obviously a lot in the news about Obamacare and healthcare legislation. What should employers be doing?
Well, there's a couple of things. So employers really need to make sure that they're paying attention to the compliance aspects of the legislation. Clearly, that's the #1 priority. However, regardless of the legislation, employers really need to be paying attention to their health of the employees, the wellness of their employees. You know, how do I make sure that I'm keeping them healthy so they're at work? So really looking at that health, wellness, and productivity equation so that it doesn't negatively impact their bottom line.
It's very important, isn't it, for all employers to actually be looking after the healthcare of their employees?
Most definitely. Regardless of the size of the employer, they really need to make sure that they understand what the drivers are of their employees, because certainly when their employees aren't at work, they're not able to get the job done. So the primary responsibility of that employer really comes down to making sure those employees are, healthy, at work, productive, so that they're able to accomplish what they need to accomplish.
It all makes sense, but it's not that easy, is it? For a lot of employers, a lot of people don't actually know where to start, right?
That's right. It's not an easy conversation to have, but by working with their healthcare carrier, a lot of employers and/or their consultants, a lot of employers can really sit down, analyze their health data and information to determine what are the best programs, incentives. Do I have a population that has, an issue with diabetes? So would I want to implement a chronic condition program to help employees better understand and manage their diabetes? So sitting down with your carrier or your consultant really is going to be the first step to really understanding the data and then understanding what those programs are that the carriers have that are available. Like at Cigna, we have an entire suite of programs that are available for employers to help engage their employees, understand what kinds of incentives are going to work. A lot of employers have tried, disincentives or incentives. Incentives tend to work a lot better. And then that way they can determine what are the programs that they want to implement to really help them engage their employees.
Good employers these days put a lot of effort into keeping employees well rather than looking after them when they become sick, maybe.
Most definitely. Certainly you have to have a program in place and a benefit program in place to make sure that your employees have access should they have a catastrophic situation. But a lot of employers in today's marketplace are really focused on encouraging their employees to adopt healthy lifestyles, have their families adopt those healthy lifestyles, because you can't just impact the employee, you got to get the whole family involved. It's a lot easier if you're going to get into an activity program or a fitness program if the whole family's engaged there. And a lot of employers are taking on that responsibility as good corporate citizens.
A lot of the work that you're talking about as good corporate citizens is regardless of the legislation, but the legislation itself brings quite a lot of an onus to comply, doesn't it?
It does. The legislation has a lot of requirements. Some of them are just coming up, like employers have to send a notice out to their employees October 1st about these public marketplaces, as well as the availability of a federal premium tax credit that'll help people within a certain poverty level actually purchase the coverage through a subsidy. There's also information about fees and taxes that is going to be coming out, where they have to actually pay some of the fees and taxes to the federal government to really help offset some of the costs of the legislation. So there's a lot of those aspects that the employers really need to look at. And actually on informedonreform.com, which is Cigna's award-winning website, we actually have a timeline out there so employers can actually go click on a provision and find out all the specifics. So there's a lot of good information out there, as well as news alerts and explanations of some of the pieces of the legislation that employers really need to watch for.
Great. Kathy, thank you ever so much indeed for joining us today. Really appreciate it.
Thank you very much for having me.